Hi, it's Dr. Maria Lee. Coughs and colds are an inevitable part of a child's life, especially in the winter season. Parents often ask me whether over-the-counter cough medicines are recommended for children. The answer is no, they are not. In 2012, the Therapeutic Goods Administration of Australia conducted a review on the use of cough and cold medicines in children under the age of 12. They concluded that there is no scientific evidence that they are effective, and rarely adverse reactions have been reported, such as shallow breathing, heart rate abnormalities, drowsiness, nausea and constipation, confusion and hallucinations, and in rare cases, seizures. So if you shouldn't give your child a cough medicine, what should you do? Firstly, take them to the doctor. A cough can be a symptom of many conditions, such as asthma, cold, flu, bronchiolitis, croup, and many more, all of which are treated differently. The following strategies may also help. Drink plenty of fluids, avoid exposure to cigarette smoke, and saline nasal drops, followed by the use of parent-operated nasal aspirators, may help relieve a blocked nose. There is some evidence that honey may reduce the severity and duration of a cough. In children over the age of 12 months, give 1 to 2 teaspoons before bedtime. Do not give honey to babies younger than 12 months, because some honey can occasionally contain spores of the bacteria that cause botulism, and babies younger than 12 months do not have a sufficiently strong immune system to kill these spores. So in summary, cough medicines are not recommended for children. Simple, inexpensive measures and a trip to the doctor are often the best treatment.